Out of all the possible dental procedures, I think root canals are up there as one of the scariest. I mean, they just sound scary. Root. Canal. But what exactly is a root canal, and should you be scared of getting one? Hey guys, my name is Amanpreet Singh, and I'm the founder of Dental Secrets. Today I'm going to be going over all about root canals, but before I get started, please hit the thumbs up button and subscribe to my channel below. Let's get into it. Typically, a root canal is needed when your tooth gets infected. That means the nerve supply and the blood supply have to be cleaned out of your tooth to get rid of that infection. This infection usually comes one of two ways. Either from a large cavity that reached the nerve of your tooth. This means that that cavity broke through your enamel, reached your dentin, and traveled all the way to your pulp, or the blood supply and the nerve supply of your tooth. And sometimes that infection can spread to the bottom of the root and form an abscess at the tip or the apex of the root. A root canal can either be done by your general family dentist or an endodontist. An endodontist is a dentist that specializes in root canals, so they'll typically see the more complex procedures. The way a root canal is done is the decay is first removed from the tooth. Then your dentist will locate all the canals that are in your tooth. The canals in your teeth are responsible for keeping your teeth alive. They're basically really small passageways that deliver nutrients and other supplies to your teeth, and they're located within your roots. That's why it's called a root canal. Each tooth can have a varying number of canals. Typically, your front teeth will have 1 to 2 canals, and your back teeth will have more. That also makes these harder teeth harder to perform root canals, and why your endodontist might be the one to do them. People who need a root canal can be in a lot of pain. Before performing a root canal, a dentist will probably check this by performing a series of tests. This includes cold testing, which is basically putting something really cold against the tooth and seeing how you respond. And this also includes tapping the tooth to see a response, feeling the gums around the tooth, and also checking the health of the gums around the tooth. What a dentist is trying to do is to recreate your symptoms, and in doing so, they can diagnose whether or not you actually need a root canal. And this will also help determine if the tooth is even fixable in the first place. And people who need a root canal may also not be in any pain at all. That means that your tooth is dead. So when a dentist tries doing cold testing against that tooth that's dead is not going to have any response compared to the teeth around it. A normal response for this cold test would be for you to actually feel the cold, but it shouldn't hurt a whole lot and the sensation should go away pretty quickly. Most people would prefer their tooth to be dead when needing a root canal because they want to avoid any pain. But the problem with that is sometimes they don't believe me when I tell them they need a root canal. Here's a typical scenario when I'm testing a tooth that needs a root canal. Okay, I'm going to put something cold against your tooth and I want you to let me know if it hurts. Ouch! Oh my god, that really hurts! Does it hurt? Yes! Oh my god! Yeah, you need a root canal. Or it can go like this. Do you feel anything? Nope, I don't feel anything at all. Yeah, you need a root canal. What the heck? That didn't hurt at all! But what would happen if you don't get a root canal? I mean, if that tooth's already dead, there's not much worse that could happen, right? Wrong! First of all, if you need a root canal and that tooth has a cavity, that cavity is going to spread. And it's going to spread to the point where that tooth is no longer fixable and you need to pull the tooth. And also, if your tooth has an infection, that infection doesn't just stop around your tooth. For example, one scary complication could be that that infection spreads to your throat and cuts off your breathing. And you know, sometimes a root canal isn't your best option. Sometimes it's better just to pull the tooth. When a cavity is already really large, sometimes a root canal is unpredictable because there's not much tooth structure left. The end goal is for you to still have a tooth there after the root canal is done. So sometimes you'd be better off getting the tooth out and putting an implant in instead. And you really got to look at what's worth it for you. If it looks like a borderline situation and that root canal can probably buy you about 5 years before that tooth needs to come out, it might be worth it to get an extra 5 or so years out of that tooth before needing an implant. Obviously, the goal of a root canal, just like any dental procedure, is for it to last a long time. But that's not always the case in dentistry. Not everything is black and white. Sometimes your tooth is already compromised, and buying another 5 or so years out of it seems like a pretty good deal. And root canals, just like other dental procedures, rely a lot on the patient's compliance at home. If you don't keep your teeth clean and do all the necessary measures at home, that root canal is not going to last as long. So should you be scared of a root canal? Well, the actual procedure is pretty straightforward and you're numb the whole time. Like we said before, your dentist will start by finding all the canals in your tooth. Once the canals are found, he'll put some files in there and this will clean out all the infection and the nerve supply of that tooth. Also, during that process, he'll put some bleach and other irrigants into those canals, and this will help disinfect and clean off any debris that's in those canals. Once those canals are clean, the dentist will fill and seal off those canals and eventually put a crown to protect the tooth. Look, I know this sounds scary, opening up your tooth and cleaning out those canals, but the goal is to get you out of pain. Like I said before, you're numb the whole time, and usually afterwards, people don't even feel it because that nerve supply to to that tooth is completely gone. But that being said, sometimes people do have some lingering effects after a root canal. Sometimes it takes a little while for that infection to fully clear out of that tooth. So in that case, you would need to take some antibiotics for a while, but that infection is going to go away on its own because the source of that infection has already been cleaned away. Most of the time, people who need a root canal are people who avoided the dentist out of fear in the first place. Like I said before, the longer you wait, the longer it gives that cavity and that infection to grow. This is why it's important to not skip the dentist. Even then, sometimes it's just inevitable that you need a root canal. For example, sometimes people crack their teeth and that crack goes into the nerve supply, so they need a root canal regardless. Just know that a root canal is a routine procedure, and the goal is to get you out of pain and not to put you in pain. Thank you guys for watching. I hope you liked that video. If there's anything else you wanted me to add or any questions you had, please let me know in the comment section below. And if you haven't already, please hit the thumbs up button and subscribe to my channel below. I'll see you in the next video.